In your upper extremity, it has a very similar structure to your lower extremities, but a little bit different, and they certainly have different names. So the humerus, right here in the upper arm, you have the radius, which is on the thumb side, and the ulna, which is on the pinky side. You have carpals, which are wrist bones, metacarpals, which are hand bones, and the phalanges are the finger bones. So here's kind of another picture of all your different bones kind of put together. All right, so muscles. Muscles are important to allow us to maintain posture, and they allow us to move. They also do some other things that we don't necessarily have control over. For example, the heart. The heart is made completely of muscle. It's a particular type of muscle called cardiac muscle. Very specific. And you can see how in this picture over here it looks different from the skeletal muscle and the smooth muscle. So skeletal muscle, it's a striated muscle, so it looks like it has little stripes in it, and you can see that here. And that's just the way the muscle is structured. It just looks like it has stripes in it. Cardiac muscle is actually also striated, but we don't have any control over it. So we call it a third different type of muscle. Smooth muscle, however, is not striated, and it's something that we don't have any control over. It's an involuntary type muscle. Smooth muscle is found in a lot of different places. It's found in intestines. It's found in blood vessels. It's found in bronchioles. It's found in the uterus in females. And all of this smooth muscle is involuntary. We don't have any control over the movement of this muscle. So skeletal muscles, like I mentioned, are voluntary muscles. Muscles attached to bones by tendons that go across joints. So make sure you know what tendons are. Tendons attach muscle to bones. If you shorten the muscle, it moves the joint. I think the easiest way to think about that is you can actually take right now, put your arm out, and I want you to do a bicep curl. I want you to look at your bicep and feel your bicep. And you can actually feel that bicep shortening if you put your hand on it. So the bicep actually shortens up. You can feel that. And it moves your elbow joint. Smooth muscles, like I mentioned, carry out involuntary movements. They're found in the gastrointestinal tract, in the genitourinary tract, in the respiratory tract, and in blood vessels. So all the places we have muscle that we don't have any control over, it's smooth muscle. Cardiac muscle, it's a special type of muscle. It's found only in the heart. It has a property known as automaticity, which means that it can initiate its own contractions without any sort of external stimulation. It can beat independently. You can take a heart outside of the body and it continues to beat because it does it all by itself. As I mentioned before, tendons are the connective tissue that connect muscle to bone, right there. Ligaments, however, connect bone to bone, and they help support joints. They have similar presentations when they're injured to an injured muscle, but you may find the pain tends to be more sort of in the joint or near the joint, but it's hard for us to tell. Cartilage is another type of connective tissue. So cartilage is the thing that covers the ends of bones. So this is called articular cartilage or joint cartilage, and this is the knee right in here. You have the meniscus in here as well. Cartilage is also the stuff that gives structure to noses and ears. Joints. So joints are the joining points of bones. The bone ends again are covered with cartilage. Ligaments connect bone to bone, and the joint is between the connection of bone to bone. The inner surface of the joint capsules, where you have them, are lined with this stuff called synovial fluid, or with synovial membrane, which produces the synovial fluid, and that helps lubricate the joint. And we have different types of joints. In the skull here, we've got a fixed joint. Your hip and your shoulder are ball and socket joints. Your knee and your elbow are hinge joints. So that's our overview of the system. I'm going to talk now about trauma, extremity trauma associated with the system. So a fracture. The definition of a fracture is that it is a break in the bone's continuity. And you can see in this picture, this is a nice Colles fracture here going on. So fracture causes, you can have either a direct force, an indirect force, a twisting force, or a torsion. You can have diseases of bones, that we basically call pathological fractures, like osteoporosis, and tumors can cause fractures. Fractures can be either open or closed, and this is an important thing for you guys to know. Closed simply means that the skin over the fracture site is intact. Open means there is some sort of break in the skin over the fracture site. The bone ends do not have to be exposed. Even small openings in the skin that communicate with the fracture site mean that it's an open fracture. Open fractures are much, much more serious, in part due to external blood loss, but also very much so because of the potential for infection. You don't want infections to get into your bones. That's a bad place to have an infection. Here's a picture to gross you out. I think this is probably somebody's tibia popping out of their leg there. So this is a graphic here. This is a closed fracture because you can see the skin's intact, and an open fracture here. Bone's not sticking out, but it's open to the air, so there's potential for contamination and bleeding. So one of the most important things that we can actually do in EMS is prevent closed fractures from becoming open ones. Turns out when you fracture a bone, the bone ends are fairly sharp, and it's not difficult for those bones to kind of poke through the skin. So we do things like splinting to help keep the fracture from becoming open. There are a few different fracture types. So a transverse fracture, as pictured here, is where you have a fracture at a 90-degree angle to the shaft. An oblique fracture is a fracture that is at an angle other than 90 degrees to the shaft. And a spiral fracture is a fracture that coils through the shaft of the bone like a spring. There's also angulated, which means that the bones have gone at an angle. That first picture you saw had an angulated fracture. It may have also been displaced. I can't remember. I'll have to look. Let's go look. Let's see.